Okay, what we want to focus on right now is what the peer-reviewed guidelines suggest for clinical utilization of radiographic digitizing analysis, or what is commonly known as CRMA, which stands for Computerized Radiographic Mensuration Analysis. These two things actually mean the same thing. So, what we're going to do now is we're going to concentrate on this language that's found right in here. And we want to know how doctors are supposed to clinically utilize this procedure, right? So if we take a look, we can say computerized x-ray analysis may be used by chiropractors to objectively is a pretty important word. That means without the input of the patient. It means it can be established through measurement or some sort of way that it can be verified. So computerized x-ray analysis may be used by chiropractors to verify the biomechanical and misalignment improperness related to vertebral subluxation. So if we have a misalignment of the vertebra here, and you can see that these misalign, they offset. This one goes this way, this one goes this way, and there's an offset here. Okay, that offset is called a spinal misalignment. Now, when that spinal misalignment actually causes a problem or interference to the nerve coming out of here, then we call that a spinal subluxation. Now we can also call it a spinal instability, because at that point the spine, due to this damage, is not stable enough to not be re-irritated quite easily to damage that nerve or cause problems with that nerve. So it says here, clinical necessity is justified for assessing the degree of insult. Now, insult is a term for the degree of damage. So again, we see here damage, we see here damage, and we see here that this damage actually causes things to occur within the vertebral motion unit, such as angular patterns are abnormal or translation patterns are abnormal. And these offsets are actually due to ligament damage. So it allows us to determine the amount through a simple test of how much damage there is. So the more joint play there is, and we see this is the back and forth motion of the vertebra, the more joint play that there is, the more damage that there is with the spine itself. Okay, so it helps any provider to determine how much damage did you actually have to your spine. Now, it also says we take the degree of damage and the effect upon the patient's health and future well-being by way of impairment rating. So let's talk about that. This information of what the measurement for these findings are come right out of here, the AMA impairment guides. Now, those AMA impairment guides allow the provider to determine how much of this do we have, and does it actually qualify for inclusion into the impairment guidelines. Now, the beauty of that is that now the doctor does not have to give their personal opinion as to how injured the patient is. They can use the consensus of the permanent impairment guidelines, which is, quite significant, because what the doctor wants to do, you want to stay out of subjectivity and you want to stay in objectivity. And that's what a CRMA peer-reviewed guidelines says is the clinical utilization for this procedure.